Get away from me.
Back off, mate. Come on, back off, mate.
Back off.
In emergency, a highly aggressive man is trying to smear his blood on staff.
Quiet in the room.
I would describe him as critically injured.
1, 2, 3.
Bleeding from the ears and from the mouth. No helmet in evidence.
Stop bagging, he's actually stopped breathing.
The patient is, in essence, drowning in his own blood.
This gentleman's brother was also injured.
They all just sit around, you know, chatting all the time.
Having some drinks.
Why don't they just do... I mean, if I was there, I'd be swimming.
You'd be
doing
investing
stuff.
yourself doing
I'd
activities.
be doing
not...
stuff.
At the Royal Melbourne Hospital, senior emergency doctor Jonathan Papson is discussing reality TV dating shows.
I wouldn't be wasting my time
Chatting to people.
chatting to... What are they doing? How much can you chat to these people? You know, I'd be swimming, I'd be enjoying Fiji.
But a call puts an end to that.
Hello, it's Jonathan Papson, emergency. 1540 on the helipad. All right, thank you. Bye. 20-year-old who's crashed her car towing a trailer. She's not wearing a seatbelt. She's rolled. She's hurt her ribs. Probably has nasty injuries.
Dr. Jonathan's about to receive a young dairy farm worker who's rolled her ute in rural Victoria.
When someone's not wearing a seatbelt, it automatically ups the ante and the risk of what injuries they might have. All right, so we're going to all listen to the handover.
So this is Riley. She was unrestrained. The seatbelts don't work very well apparently in the vehicle. She hit a pothole, hit the brakes of the vehicle, and the trailers pushed her, and she's ended up rolling at least once into a paddock onto the side of the road. My exam finds she's got quite a large hematoma on the top of her head. She may have hit butted the windscreen looking at the actual incident.
Often we don't see anything on the outside of your head, but if you've got a hematoma or a bruise on your head, it's a marker that tells us that there's been an impact there. So we're worried about a bruise on the brain.
Right, darling. Just get you to fold your arms across your chest for us, okay? And give yourself a hug.
20-year-old Riley was thrown around the ute with incredible force, hitting her head and body.
Saw that? Yeah, saw that. No, that's okay. Yeah.
That sudden stopping force without a seatbelt is where you tear your major organs, and that's what kills people in car crashes. And did you get yourself out of the car, or you couldn't get out?
I just remember, I don't remember actually crashing as such. It's just what they've told me's happened.
When we talk to patients, even from the very start, we get a sense of what their brain injury potentially might be. So within a few questions, often we get a sense that there has been a head injury. Those little subtle things that people wouldn't normally say when talking to strangers are little clues to us. So we're thinking, this isn't quite right. The thinking's not quite right here.
Dr. Jonathan orders x-rays looking for rib, limb and pelvic fractures.
Yeah, it's Jonathan. Can I get a mobile chest and pelvis in trauma, please? Is your face sore? I mean, you've got lots of dirt and stuff on your face. Yeah, did you have a blood nose or anything?
I did when it happened, but that was all.
Yeah, okay.
I can remember looking in the mirror and the trailer going everywhere, and I put my foot on the brake, and that's all.
Riley's sketchy recollection of the accident is a sign she may have a brain injury.
We'll give you something for the pain. How bad is it now?
It's bad when I breathe, but when I'm not breathing.
Yeah.
Riley's mum and stepdad are on their way to be with her.
Very fast rollover with a trailer. It's just her flying through the air, hitting something, and that's the problem, because when she hits something, that's where you get the most damage to the body. That's where the chance for lethal injury really escalates.
From Melbourne Receiving.
Yeah, g'day, Royal Melbourne. It's Alex on the on 953. We're coming to you within about less than 10 minutes. Motorcyclist, closed head injury.
A call's coming in from paramedics rushing a critically ill patient to emergency.
Do you know what the mechanism was?
Yeah, motorcyclist versus car. This is the motorcyclist.
So, a motorbike accident.
Senior Emergency Dr. Sarah Whitelaw and Dr. Jason Gabriel Anasaur are preparing to treat the unconscious man who crashed his motorbike and was thrown headfirst into a car windscreen.
So what do you want to do? You want to do the airway?
I haven't done it.
All right. Do you want to manage it?
I'll run it.
Do you want to run it?
Yep.
And I'll back you up.
Okay.
So we've got a motorbike accident coming in. Their heart rate is very fast, so possibly bleeding. This case is one of our most difficult type of cases because we don't get a lot of time to prepare. And I'd be lying if I said there's not, stress and adrenaline around this situation.
Hey, Matt, can you get me some blood for a unknown male?
We've not really got much to go on at the moment, so we're just kind of getting the team together and kind of planning for potential injuries and illness. Okay, guy, patients here. If you're going to be in the room, can we get some lead on, please? Okay. So, can we keep the noise down? We'll get the patient across. Can we get full monitoring on? Ilya, if you make your airway assessment and get ready to tube.
So, just quickly, this is a motorcyclist. He was travelling, the witnesses say, about 50 k's an hour coming around a bend onto a main road. There was no helmet in evidence. He's got abrasions all around his body, but his main injury is a closed head injury, bleeding from the ears and from the mouth, thick bloody blood.
1, 2, 3.
10 minutes ago, we loaded roughly.
I'm guessing we don't know any past medical history or anything.
We don't
else.
know his name. We don't know the registration number of the motorcycle or the vehicle. We just didn't hang around on scene.
An accident on a motorbike, particularly if there aren't helmets involved, we know can cause really bad facial and head injuries. We always prioritise injuries that might interfere with breathing, and we want to stop any sort of active blood loss.
The patient's condition is so critical, another doctor, Bjorn Macon, joins the team to help clear the man's airway so he can breathe.
We have to address the immediate life threats in the patient, and the first thing is always going to be the airway, because without oxygen, the brain will die in 5 minutes.
So, team, priority will be to secure his airway. Quiet in the room, drugs are going in, please. Yeah.
I'll let you know when to proceed at 60, okay? Stop bagging. He's actually stopped breathing now.
You're assisting him with positive pressure, yeah?
Yes. Stop bagging. He's actually stopped breathing now.
In the Royal Melbourne's emergency department, Dr. Sarah Whitelaw's team is dealing with a life and death situation. The patient crashed a motorbike into an oncoming car and went through the windscreen head first.
I got it.
Do you want to come from this side or the other side?
Coming from this side.
Okay.
With help from Dr. Bjorn Macon, the race is on to get their patient to breathe.
In the back of my mind, I'm thinking this is going to be very difficult because the patient is bleeding into his airway and is, in essence, drowning in his own blood.
Okay, let's go. Yep, I agree. I'll squeeze.
Sats are 78. We know that we need to get oxygen into this patient immediately. Normally, we would put a tube in through a patient's mouth. In this patient, his face is so badly damaged that that's potentially not possible. Talk us through what you're seeing.
Okay, Sats is 77.
Okay.
If we could bag, let's just pull out and bag him.
Okay.
Sats are still at 77. Can we go two-handed if we need, please?
If we can't get the tube in the usual way, then we're going to have to make what we call a surgical airway, a hole through the front of the neck, and put the tube in that way.
Okay, Sats is 71. Bjorn, are you getting surgical kit ready?
Second attempt, and then we're set up to do a surgical airway.
Okay.
Well done.
Visualise past the cord.
Okay.
Okay.
Okay, just keep going, keep going. 64 is...
And is the oxygen turned up all the way?
The trauma team needs to focus on the man's breathing. It's touch and go.
Okay, sats are coming up, guys, so we're in the right place.
Sats are coming up. We're going in the right direction.
Well done.
With the patient's breathing now stabilised, the priority is looking for any life-threatening internal bleeding and brain injuries.
We need to get him to CT quickly, don't we?
Yeah.
Got a CT ASAP.
I guess one of my questions is he actively bleeding from anywhere, kind of... Can see he's bleeding from the right side of his right ear and it's actively dripping.
Main concern is a significant closed head injury. CT are ready for us now.
So significant head injury, but other than that, we don't know. But I would describe him as critically injured.
In the midst of the chaos, Dr. Sarah finds out more distressing news.
The police have just let us know that this gentleman's brother was also involved in the accident. So his brother is actually here and also injured, and we'll have to find out how severe his injuries are.
All right. And have you had trouble with blood noses before?
Yes.
What's happened in the past?
Same thing.
Same things, okay. Down the back of your throat.
In a nearby treatment room, Dr. Maya Kubert is meeting 62-year-old grandmother Miro, who's been battling a serious nosebleed for hours.
And you're on warfarin, is that right? How long have you been on the warfarin for?
25 years.
Okay, and that's for a valve?
Well,
mitral valve or a mitral valve? Okay. Yeah, you're right. No, long night. I'm just going to go and get a spray. I'll be back in a minute. Okay.
Her blood is being thinned by a tablet called warfarin that is stopping her blood clotting because she has an artificial heart valve. But when your blood is really thin, it doesn't clot. So stopping the blood nose like the rest of us would be able to do with just a little bit of pressure is very difficult for her. And it can be life-threatening if she can't stop the bleeding.
If Miro's nose continues to bleed, it will lower her blood pressure, causing weakness and fainting. It could even damage her heart and brain.
All right, young lady, we're just going to spray this gross stuff up your nose. And it's just going to make you... It's a horrible taste.
Dr. Maya's first step is to spray Miro's nose with an anaesthetic, which numbs the area and helps tighten blood vessels.
This is horrible. You're a brave soul.
Yeah.
All right. Doing a good job. Just running a bit, that's just the spray. Some of it's coming back in. But if it starts to bleed back down the back of your throat, it's really important that you let me know, and it's really important you try not to swallow it and spit it out into there for me.
Okay.
Yeah, yeah. Is your husband here?
No, yes.
He's coming, is he?
Yeah, I come by ambulance.
If the bleeding goes on for longer, you can lose a fair amount of blood from a nosebleed, so it can put you at risk. So your blood pressure can get low, and we need to obviously replace the blood if it becomes a large amount of losses.
If the bleeding doesn't stop, Miro could need surgery.
And I said to my husband, I'm scared to go in bed.
Yeah.
Guys said I start bleeding again.
I wouldn't be surprised if you've got some broken ribs there.
Back in trauma, Dr. Jonathan Papson's waiting for X-ray results of dairy farm worker Riley, who rolled her ute and was thrown around the cabin because she wasn't wearing a seatbelt. Jonathan suspects the 20-year-old has fractures and possible life-threatening head and spine injuries.
All right, darling. We're just going to put you onto a nice and fitting collar, okay? Perfect. Happy with that.
My boss came. They couldn't get me out, and then the firefighters came and cut me out. It was that helping.
Riley's parents are making the 3-hour drive to the hospital.
Oh, yeah? On the line of that. Hello?
The X-rays are inconclusive. So Dr. Jonathan orders a full body scan as he's worried Riley has serious internal injuries.
The CT scan's going to have a look at your entire spine, from your neck all the way down, and all your vital organs and everything in between. We'll be able to figure out if there is any damage to any of your internal organs or anything. Okay?
Nurse Sheridan Dobson explains to a frightened Riley what's about to happen.
1, 2, 3.
We're worried about her neck because she wasn't wearing a seatbelt. We're thinking rib fractures, maybe bruising to the lungs. We're also looking for spine injuries, and we're always worried about an abdominal injury as well in someone who's been in a crash without a seatbelt.
As Riley waits alone to hear what the scans show, her biggest fear is calling her dad about the crashed ute.
Hello, Dad. Did you see the ute? Am I in trouble? Mm-hmm.
So I don't want you to swallow any of the blood coming down the back of your throat. So I want you to put some water in there, gargle it all around.
Dr. Maya Cubitt's trying to get grandmother Miro's nose to stop bleeding.
When did it start bleeding?
I bled last night for hour.
Yeah.
I was in emergency.
Here? Have you been in our hospital with that problem?
Yeah, I was here.
Yeah.
It's the second time in the last 24 hours she's been rushed to the Royal Melbourne Hospital for the bleeding.
Is it still going down the back of your throat?
Yeah, but I felt in my throat I have blood.
Do you think it's probably stopped now?
No, it's not.
Not now. Okay, I'm going to have a look.
It's still bleeding.
The anaesthetic spray Dr. Maya used hasn't stopped the bleeding.
In Mira's case, her blood is thinned. She's using a medication to stop her blood from clotting. It will clot, it just takes longer. We're going to move towards that horrible pack, but we're going to do it in stages. I'm going to try the spray again. The benefit of the spray, if we get it really covered in there, is that it'll help with the uncomfortable pack because it's a bit numbing. But in order for it to work well, we'll need to get the clots out first. The first thing we do is to try to clear out any of the things that might be in the way of the blood clotting. So we actually weirdly get her to blow her nose to try and make the surface of the area where we want the clot to form a nice clean surface.
But blowing out the clots will first make the bleed worse, and Dr. Maya prepares Miro.
So this is going to be really uncomfortable, hun, and I apologise in advance.
Miro's distressed, and her husband Ninad is yet to arrive.
Good one. Which side is it that's bleeding the most? The left? Both. Big blow for me. Blood is not something that people are used to seeing. It makes you immediately aware that something is wrong. So some of her fear is about her lack of control and her inability to manage the situation and her fear about what that means.
Dr. Maya updates her notes on Miro's condition while waiting to see if the bleeding stops. But the yelling from an aggressive patient nearby makes it hard to concentrate.
I think we convince ourselves that we can block it out, but it creates a general low level of stress, I think is the reality. And fear. Sometimes things get a bit out of hand.
JK, you let me know if you need a hand.
Dr. Sarah Whitelaw feels it too. Her husband is a surgical specialist at another hospital, but not in emergency.
There's obviously some of us that are less bothered by it than others. My husband will walk a kilometre out of his way to not walk through the emergency department. He just refuses to come and visit me there because he just finds it a horribly chaotic, loud, noisy, out of control environment.
Get away!
We just need to open the door. He's up to some sort of shenanigans.
Please open the door.
Over in the behavioural assessment unit, Dr. Martin Dutch is also dealing with a difficult situation.
I don't think it'll work.
Please open the door.
It's all us.
An agitated patient has locked himself in a toilet cubicle,
Please open the door. The security is here. Come on.
and security are standing by.
Otherwise, I'll go up to Sherilyn's office to get the toolbox. I'll go and do that.
Come on. Open the door.
I wouldn't be surprised if he's got something else. Good for speed. under lack of protective gear.
In the CT room, Dr. Sarah Whitelaw's motorbike crash patient is slipping between life and death. Scans show massive fractures in his skull.
He was pretty close to dying, I would say, quite frankly. Ultimately, it's quite likely he'll need to go to the operating theatre with a neurosurgeon.
After helping Sarah bring the crash victim back from the brink of death, Dr. Bjorn Macon is called to resus to treat the younger brother, who was on the back of the motorbike.
ED is all about an ability to rapidly respond to the situation and to be pretty malleable, both in terms of your brain and in terms of your mood. It's almost masochistic, isn't it? A lack of control.
Ready? 1, 2, 3.
And the reason you say the shoulder is dislocated is... Yeah.
Can't move it much.
Yeah. Whatever's going on, there's something. Take some deep breaths for me.
Before he can deal with the dislocated shoulder, Dr. Bjorn must first check for any internal bleeding.
We're going to cover you up and get your pants off, okay? Are you wearing... You're not wearing undies?
No anymore.
Yeah, but we'll cover you up with the blanket, okay?
Please.
Listen to me. I have to look at your legs, okay? You've just come off a motorbike. You just need to let me do my job, okay? I need to ultrasound your tummy. I need to take those pants off, okay?
I can see that there is a very confused and I would say at worst brain injured, I suppose at best probably concussed patient with other injuries. So I made the decision then to try and calm him down, deal with his injuries. So it is a difficult situation.
The ultrasound rules out bleeding, so Dr. Bjorn is moving on to the dislocated shoulder.
Please.
It's okay. It's burning.
It's okay, that's normal. That's normal.
Oh shit.
Get used to it. And we're done.
The team has successfully put the man's shoulder back in place. He has no idea his elder brother's life is on the line.
It's one of those, I think, sad situations where we haven't actually been able to tell him that potentially his loved one is quite severely injured.
Open your eyes.
Good. He's still got a concussion and he's not really making new memories. So we're going to have to wait for him to sort of start making those memories before we then try and break the bad news that his loved one's potentially got an unsurvivable brain injury. We'll have to see.
And did you get yourself out of the car or you couldn't get out?
I don't remember actually.
Dairy farm worker Riley rolled her ute in rural Victoria. She was flown by air ambulance hundreds of kilometres from home to the Royal Melbourne Hospital with possible head and spinal injuries.
For us, in emergency, this is what we do. We see people coming in all the time with injuries, but for the patient, they weren't expecting to be coming to hospital. This has completely interrupted their day and it's interrupted her life. Who knows what consequences are going to come from this split-second thing that happened to her.
Riley's mum and stepdad have made the long drive to be with her.
It was a horrible thing to turn up to, knowing that your daughter had been in a car accident, and to get there with police cars and ambulances and fire trucks and a helicopter and people everywhere and a vehicle in the paddock. I just felt sick.
Riley must wait until scan results reveal the extent of her injuries.
It's really important to have family, especially with Riley. The constant reassuring and reorientating is pretty necessary because she might not be laying down memory very well with her head injury, and that's what we're thinking is happening.
We'll just have to wait until we know.
All right, so I think he's really tachycardic. It's quite possibly because he's in pain. He's got a really whopping great palpable pulse now. I think we need to make sure that he's adequately analgesed and sedated.
Back in Trauma 2, Dr. Sarah Whitelaw's team is still fighting to save the motorbike driver who crashed and was thrown head first into a car windscreen.
Hi, it's Jason in emergency. We've got an unknown male. He looks to be in about his 30s. So he's been seen by the trauma team and neurosurgeons to hear it.
To reduce the dangerous swelling on his brain, neurosurgeons have been called in to drill a hole into the patient's skull.
We're worried about increased pressure within his brain. So the neurosurgeon's gone to go and get a device to put in to monitor the pressure in his brain.
Down the corridor, the driver's younger brother, who was on the back of the motorbike during the accident, has had his dislocated shoulder fixed.
We can't tell anything yet, sweetheart, because he's just been to scan.
He's also concussed and has no idea how seriously injured his brother is.
This young man hasn't got the same severity of injuries that his brother does. I think potentially because his brother actually provided the, to use a very poor term, cushioning against the forces that were going through his body. I can only imagine putting myself in that position, how devastated I would be to know that my sibling was dying in a room next to me.
There's not a lot more we can do. He will need to go to the operating theatre and then probably to the intensive care unit.
As the driver is wheeled off for surgery, his younger brother is monitored nearby, and Dr. Bjorn takes a moment to reflect.
When you're constantly confronted with these situations, in order to protect yourself, you can wall off your emotions. And I think that something that is very difficult to do is to remain open to these situations, I've heard someone describe it as sit in the rubble is one of the terms where rather than trying to say that everything's going to be okay, you actually sit in the rubble and the destruction that's there with the person. And I find that that's very difficult because I'm a fix-it kind of person, but some things are unfixable and there's nothing that you can say that's going to make it all right. What are horrific, the worst days of their life.
Open the door now, please.
Back in the behavioural assessment unit, Dr. Martin Dutch is trying to get an agitated patient out of the toilet.
It's okay, you're not in trouble. We just can't have you locking yourself in the toilet.
Not very nice.
As the Director of Emergency, Dr. Mark Putland worries about the abuse and violence his staff face.
It's a confronting environment and sometimes a risky one. It's a bit like being a frog in a pot of water that's getting hotter and you can just kind of get used to it and take it for granted that it's part of your job. But when you sit back and look at it, actually, you think that's absurd. It's not okay. I think it's really important to keep calling that out, actually.
How about we turn off the light and see if you can get have a bit of a nap, yeah?
With the wayward toilet cubicle patient now restrained, Dr. Martin rejoins colleagues at the main desk when more trouble erupts.
Back off, mate. No, back off, mate. Back off. Go away.
Get in your room.
Right, it was a good example of how everyone has each other's backs in the place, which is really good, but it just shouldn't really be happening.
Are you okay? Yeah, thank you. Thank you for jumping in.
I'm going to go and get the pack. I'll be back in a second, okay?
In a nearby treatment room, 62-year-old grandmother Miro is still suffering from a severe nosebleed.
It's not very nice to have blood pouring out of your face. She'll be scared.
It's being caused by Miro's blood-thinning medication for her heart condition. So Dr. Meyer is getting an inflatable nose pack called a rapid rhino.
They're really uncomfortable. They go inside your nose and blow them up with air, and we push out to stop the bleeding. I've had a lot of experience of nosebleeds in my house. One of my children gets a lot of blood noses. And what I know from experience is that it's a really distressing thing. This is really uncomfortable. Yeah. Really uncomfortable. Sorry, lovely. But do you know what? I think it is helping, all right? It's really horrible. You have a good cry, that'll help, I think. It's really scary and it's really horrible, but you're safe here, okay? I've got you. Thanks. Sometimes if we can provide that sort of calming atmosphere for people, they feel safe. It's a really scary thing to feel like you have to hand over control of your sometimes life and death situation, or your fear that it might be that, to somebody that you've never met. And with Miro, she's here because she's bleeding. She's clearly feeling scared about that. And my job is to build the trust that she has in my ability to deal with that. Okay. All right. I know it's horrible, but that bleeding has stopped. All right? Gave you a fright, didn't it? Yeah, it's okay. So I have asked the nose doctors to come and have a look to see if there's anything that we can do that isn't that horrible pack. All right? If it keeps bleeding, you let me know, okay? You're a brave lady, all right? And you're doing a really good job. And this too will end. We just need to work through it a little bit at a time together, okay? You're a brave lady. Where's your husband? Is he coming? Yeah, do you want me to give him a call? Hi, is that Nenad? Hi, my name's Maya. I'm one of the doctors at the Royal Melbourne. Are you Miro's husband? He's on his way, okay?
If you head through these sliding doors, okay? Sorry, guys, I won't be too long.
It's late afternoon and Nurse Julia Hoyles is working the triage desk.
As a triage nurse, you're the front line. So a patient will come in and you ask them multiple questions and then you categorise them 1 to 5 on how sick you think they are.
Triage, it's Julia.
Some people, they just need that reassurance, but a lot of others really do need emergency attention.
Yeah, and your first name?
Bill.
Okay, have a seat for me. I'll come to you, hey?
Bill is a landscaper and injured his shoulder on the job. He collapsed at the work site.
So what's happened?
I left my shoulder on the air conditioning unit at work.
Yeah?
And I thought I'd dislocated it, but I don't know, I think it's just, you know, I'm in so much pain.
Okay, whereabouts in the arm is it? Right up there. And out of 10, how bad's the pain?
Oh, 9, I'd
No,
say.
it sounds like a stupid question when I see you like
9 or
this.
10, yeah.
His blood pressure's through the roof and he's quite a young guy, so that's quite abnormal.
So we're going to get him inside as soon as we can, because he's obviously very uncomfortable.
Bill's in obvious distress. I'm thinking the worst, it may be a dislocated shoulder, so I've made him quite a high priority.
Come on in, we'll get the doctor to assess it now. You're not going to pass out or anything, are you?
I feel like I'm about to be
Oh,
honest.
no. I'm here to catch you if you fall, all right?
Julia hands Bill over to Deputy Director of Emergency, Dr. Steve Pincus, who's treated countless shoulder injuries.
All right.
I'll just get him a chair.
All right. Thanks, Bill.
I like your sling.
Oh, resourceful.
Resourceful. Looks a bit painful, mate. You don't think you'd want to wear that sling for a long time. Right, good arm
Bill
first.
made his own makeshift sling from irrigation line lying around at work.
Get yourself
I
on
can't
the- you
move
can't-
it.
Okay, hang on. Good arm first. Okay, let's have a look at it.
It's apparent when I look at him that the injury is actually on his back rather than on his shoulder. One of my concerns is that Bill has injured his shoulder blade.
Tell me about your shoulder. What's all the scarring
I've got
there?
a plate there.
Yeah, what did you have done?
Plate, just like I snapped my collarbone.
Yeah.
So it's got a plate across there.
Okay, you've actually basically whacked the scapula itself. Okay, rest yourself back. Let's get you comfortable, a bit more comfortable. What do? You're Sparky, are you?
Landscaper.
Dr. Steve is worried Bill may have a fractured scapula, which could mean he'll be off work for months.
Oh. Oh.
Let me move it.
Okay.
If you move it, it's going to hurt more. Okay?
Oh.
Dr. Steve is examining 27-year-old landscaper Bill, who has severe shoulder pain after whacking it against an air conditioner. If the shoulder blade is broken, he could be unable to work for months.
Tell me a bit about you. You got a plate in there from a smash. You smashed your collarbone. How'd you do that?
I snapped it when I was skateboarding when I was younger.
Yeah.
And then also in the last 6 months or so, I got hit by a car.
Right.
And it did some damage to this shoulder again. So it's just recurring issues with this shoulder.
You can feel the plate.
Yeah.
There's a screw there.
Yeah.
There's a screw there. Yes.
Yeah.
Okay. That's not sore when I do that, is
No.
it? No. The shoulder's in.
Steve rules out a shoulder dislocation and sets about making Bill a new sling to support the injured shoulder.
Get up there. It's very beautiful. Try not to tie your hair into the...
Yes, a bit messy.
No, it's just hair's not a big thing in my life.
Quick-thinking Bill made himself an improvised sling at work.
What is it?
It worked a treat. It's actually a bit of drip line.
I was going to say, it looks like a 9mm irrigation line.
That's exactly what it is.
Exactly what it looks like. He'd had a blow to basically the back of his shoulder. So the question is, has he damaged his scapula, the bone that the arm attaches to? And so we did some x-rays and made sure that he didn't have any injuries there. I'd need to let him know that there's no fracture. So your x-rays are fine?
Oh, sweet.
You just whacked it? He'd previously had surgery on that shoulder, and that can be two things. You can actually get an increased awareness of the pain in that area. And the other thing is, because you've had pain there, you're more worried about that shoulder. Put a little dressing on it just so it doesn't catch on your shirt, but it's only just a scrape.
Oh, really? But now I just feel dumb. I don't know what I've done now. I'm like, I've just scratched my shoulder. Oh, well, at least I get the rest of the day off, eh?
Okay.
Thank you very much for your help, Doctor.
That's all right. You can go home and patent the 9mm irrigation pipe sling. I don't think there'll be a great take-up with it because it looks pretty uncomfortable.
Yeah. All right, well, thank you.
Take care, mate. I think it's important to emphasise to patients that things hurt. And just because I can't see a fracture doesn't mean that it doesn't hurt.
Bill heads home with a sore shoulder and a bruised ego. Both should be better in a few days.
That's a 78.
Dr. Sarah and her team resuscitated the elder brother in the motorbike crash case. He was rushed to surgery to relieve pressure and swelling on his brain. Despite the efforts of the emergency and surgical teams, the man's injuries were so severe, the next day, he lost his fight for life. Dr. Bjorn's patient, the younger brother, was kept overnight for observation and then discharged from hospital.
This is really uncomfortable. Sorry, lovely. But do you know what? I think it is helping, all right?
Dr. Meyer was able to stop grandmother Miro's nosebleed, which had bled out of control due to her blood-thinning medication.
It's really scary, but you're safe here, okay? I've got you.
Miro was operated on the next day by specialists who successfully cauterised the vessels in her nose.
Thank you. Okay. Thank you.
It's lovely to meet you.
Did you get yourself out of the car or you couldn't get out?
I don't remember, actually.
Dairy farm worker Riley was airlifted to emergency after she rolled her ute. Dr. Jonathan worried she had fractured ribs as well as spinal and brain injuries.
Really, Dad? Am I in trouble?
Fortunately, Riley escaped without any fractures.
Oh, she's really lucky. We don't really know what happened to her in the rollover. We don't really know what forces went through. She might have just tumbled and not actually struck anything with a great impact. She's probably been bounced around as it rolled, but we don't really know. So, yeah, she's lucky. A lot of people don't make it out of a rollover. It's a common way that people don't survive a crash.
Yeah, I'm really lucky it wasn't worse. Could be dead, but I'm not, so it's okay.
But Riley's brain has sustained damage.
Because I can't remember things, I can't make new memories, just old ones.
After 2 days in hospital for neurological tests, Riley moved to a rehabilitation centre for further treatment. She's making a good recovery and already taking tentative steps to get back to work.